Good morning, good afternoon, good evening, wherever you are in the world. It's Sabrina Khan, fuelyourselffabulous.tv. And I'm really excited because I've got Dr. Bolen on the show with me today, and we've just been having a really, really interesting chat. So yeah, can't wait to have her on. But the reason I set up this platform, I'm just going to go into a little bit about why I set up this platform and why I'm so passionate about the whole area of health and healing and IBS at the moment, which is my current theme. And well, after sort of struggling with my own sort of dieting on and off all my life and struggling with IBS issues for over 20 years, and then finding out that I had cholesterol, but 3-4 years ago I started training, and that really changed my life because I actually started eating clean. And when I say I started eating clean, I started eating foods that didn't have an ingredients list. I'm not eating sugars, good quality carbohydrates, something from the land, the sea that grew in the soil, plucked from a tree. So, and it really changed my life because not only did I control my IBS, I lost weight and managed to keep it off because I just managed to get into that way of eating. And I managed to ward off diabetes as well, which runs in the family. So yeah, this is why I'm particularly interested in this area. And my mission with this platform really is to sort of revive the way that women eat, move, think, and live, because I really do believe in food as medicine, food as fuel that you can use to heal yourself. And IBS is a huge area. I was going through a really bad time last year when I wasn't eating as well, when I was having a really sort of stressful time at work. And I was just finding that there were so many people that didn't know what they had, didn't know where to turn, were just suffering in silence. So yeah, this is why I set up this platform, just to bring you sort of people that are in the know about this area, about foods in this area. And yeah, Dr. Barbara's got a whole load of accolades behind her, but this is a live show and you can leave questions. So if you go right to the bottom of the page, you can leave your questions there. But yeah, so we're going to go straight into the interview now. So tell me a bit about your story, Dr. Bolen. We've been speaking about it, and yeah, it's remarkable. So tell me about some of the books that you've published and some of your story and your background.
Okay, so my background is as a psychologist, and I started having all these patients come into my office who had IBS. Mm-hmm. I had never heard of it, but when they described what it was like, it sounded terrible to me. Yeah. And so I did a little research into it, and I found out that the kind of therapy I did, CBT, was actually helpful for IBS. But I also found out that there was really no resource for people. So that's what prompted me to write my first book, which is called Breaking the Bonds of Irritable Bowel Syndrome. And that offers a CBT approach to symptoms. Right. So then from that book, I got the job as the IBS expert for About.com. Yes. And I've been doing that for almost 8 years. So I've really been immersed in every aspect of IBS, following the research, and really seeing that people were so underserved and needing help and assistance. And then separately in my personal life, I had my own health issues, and similar to yourself, I found that when I started changing the way that I ate, I saw significant changes in how I felt. And so it really became important to me to try to merge the two, yes. How to help people who have IBS beyond just managing the stress of the disorder, but learning how foods can help to heal IBS. Yes. And so that's been a very exciting journey for me. I got nutrition training. And then with that nutrition training, I had the opportunity to write a book on the Low FODMAP diet. And what I love about the Low FODMAP diet is that it takes away the fear of vegetables and fruits for people who have IBS. So it gives them a chance to increase those super healing produce items, but in a way that they can eat them with confidence without worrying that they're going to feel worse. So then I published a cookbook on the Low FODMAP diet called The Everything Guide to the Low FODMAP Diet. And so, yeah, I'm busy. I still write for About.com, and I now can work with clients on their nutrition to help them to ease their symptoms of IBS. And I'm also out just trying to spread the word on the low FODMAP diet.
Yeah, because we were discussing this before. I mean, I've been doing your course as well on the low FODMAP practitioners course, and you know, when I heard that it actually encourages people to eat more real food, to eat more fresh food, I was like, well, hey, this is it. I'm all for this, because I still see in groups, I'm networked in a lot of Facebook groups, you know, and you know, people are putting out, can we eat this and can we eat this, and foods with lots and lots of ingredients. And my own thing is, no, try to prepare what you can yourself, and at least that way you know what's in it, you know, and you know that it's going to be harmful for you or healing for you. So when I was going through that lecture on your course, I was going, yes, I know I'm doing the right thing here.
I'm so glad that you had that reaction. I know when I talk to people, you know, when they first come to speak with me and work with me, you know, they're living on crackers and they're living on rice. And that may be keeping some of their symptoms quiet, but it's not doing anything to address the underlying problem, which is the fact that their gut is not healthy. And what really helps a gut to get healthy is eating whole foods, eating produce. As you said, things that are plucked from a tree. I love the way that you put that.
But what is IBS? Because since I've started engrossing myself in it as well, I hear so many conflicting, you know, I hear a lot of conflicting things, and I know the official definition of IBS is the Rome 3 criteria, but what is IBS and what is IBS not? Because I know there's a whole kind of host of symptoms like tolerances and allergies, and you know, that can kind of mimic IBS signs. But what is IBS and what is not IBS, and how can people get the correct diagnosis? Because it's very important that people get the correct diagnosis, so then they can start to treat it correctly as well.
So IBS, as you know, is a functional disorder in which people experience kind of chronic symptoms of gas and bloating, abdominal pain, and either constipation or diarrhea. You're absolutely right about that. Rome 3 criteria is supposed to be used to diagnose IBS, but in real life, most doctors, when they can't find anything wrong with a person on regular testing, people just get told that they have IBS.
Yes.
So the way to get the proper diagnosis really is to start with your doctor. Because it is very important to rule out that there's not something more seriously wrong with you in terms of the inflammatory bowel diseases, which are different than IBS in that there's visible inflammation that is seen during regular diagnostic testing. And the other thing that's really important to rule out is celiac disease. Celiac disease is underdiagnosed in people with IBS symptoms, and since it's so crucial to know whether or not you have it, because if you have it, you can't eat anything with gluten without really compromising your overall health. So those are sort of the two main things that people would want to rule out. People always are asking because they're convinced they have cancer, because they feel so terrible. It must be something as awful as cancer. Cancer does have other symptoms that are not necessarily consistent with IBS, but again, that is why it is always important to start with your doctor for the diagnosis.
So something more serious like cancer, now that we're talking about it, what other symptoms would that show? I know of one, you know, blood when you go to the bathroom. So, you know, what other symptoms? Because I was really afraid as well when I was in constant pain with my spasms, and I was like, oh, you know, I've got something worse. Because generally humans tend to think the worst, I think. So, you know,
you're so afraid somebody's going to miss something, and then you're going to be that person that they open you up and you're riddled with cancer, right? That's definitely something people are afraid of.
Yes.
So, you know, what they call alarm symptoms are certainly blood in the stool, although sometimes blood in the stool is just from a hemorrhoid, but if anybody sees any blood in their stool, they must tell their doctor and have it checked out. Anemia, weight loss, unexplained weight loss, and severe fatigue. So these are sort of the alarm symptoms that are not really consistent with IBS that would suggest that perhaps something more serious is going on.
So that's why it's very important. I mean, we say this in every interview with Heather Van Boros as well. It's very, very important to get the correct diagnosis from your doctor, and if just keep going and just keep going until everything more serious has been ruled out. And I know, but I had all the blood tests, the scan, the colonoscopy, the endoscopy, so at least I knew it was just IBS after all that.
Right.
So what is IBS not then? So we've got, because again, I hear parasites, I hear candida. I mean, what is IBS not?
Okay, well, the thing is, IBS is only diagnosed if they can't find any other reason. So if you have parasites, then you have parasites. If you have celiac disease, then you have celiac disease. If you have IBD, then you have IBD. So parasites, that's again something to talk to your doctor about. If you've been to a foreign country, if deep down you just think, you know what, I wonder, talk to your doctor because you can get tested for it.
Yes.
Candida is a little bit more controversial. Regular gastroenterologists really minimize the effect of Candida as a chronic condition that would be contributing to chronic digestive symptoms, partly because there's no real easy way to test for that. But on the other hand, there are a lot of people out there who, go on some sort of Candida protocol and they feel better. For years, doctors didn't even look at the role of bacteria, and now we're seeing that bacteria plays a very big role in the onset and maintenance of IBS. And so who knows where the future research will take in terms of the role of yeast in Candida.
Yeah, I hear that it's a really kind of growth area for people, along with microbiome. It's an area that they're really focusing on at the moment.
Absolutely. And here's where there's a silver lining to IBS, and that is if you take better care of your microbiome, which is the organisms within your gut, it's going to help your IBS, but it's going to help your overall health because, again, the newest research is showing that problems in the gut could also be behind, things like autoimmune conditions, these systemic problems that doctors, as of now, don't really have good treatments for.
Yeah, do you know? I've read so many articles about that. All dis-ease starts in the gut, and that was realized 2,000 years ago. Is it Hippocrates? I don't know how to pronounce the name, but yeah, it was realized a long time ago that all disease starts in the gut. And I know certainly from speaking to other experts and doing my reading that in the Chinese culture, in Chinese medicine and Ayurveda, they put a lot of emphasis on gut health, whereas in the Western world, if you've not gone to the toilet for a few days, or it doesn't matter, it's not a big deal, or if you're not regular, it doesn't matter, it's not a big deal.
Right.
Yeah, so
we're a little slow in Western medicine, but I think that tide is starting to turn, which is great.
Yeah, it's good. It's good news, and it's good news that I think finally people are, it's just IBS. People are taking note of it with the sort of new scientifically researched diet. So, is IBS curable? That's like, is IBS curable? I think I healed my own 97%, and I'm so proud of it. And I know what aggravates it, I know what doesn't aggravate it. And I'm going to say something quite controversial here, but a lot of the foods that the FODMAPs, obviously with the FODMAPs you introduce a lot of the foods as well, but literally, I was living off a diet of very little lactose, very little wheat products, a couple of slices of toast in the morning, some carbs in the afternoon, but mainly white fish, chicken, a little bit of beef here and there, and vegetables, and I'm fine, and I've been kind of living that way for the last 3 or 4 years, and I don't think I look nutritionally, like I'm under nutrition.
No, you look gorgeous.
I don't think I think, so that was my diet story. But do you think IBS is curable at all?
Okay, so traditional wisdom would say no. It's a chronic disease that waxes and wanes. But I have talked to so many people who have really found a way to get their IBS under very, very, very good control. And by that, meaning most days they're symptom-free. Yes. But I do feel that you know, each body tends to have its own vulnerabilities.
Yes.
And so when we're under stress or the immune system's a little bit off, so for some people it's migraine headaches, for some people it's back pain, for some people it's stomach. And so I don't know that people who have had IBS in the past ever get to that point where they have a stomach of steel, but I do think that they can get to a place where they really can live comfortably without always having to worry about what's going on with their stomach.
And would you say that's mainly through diet and correct stress management and relaxation?
Right, so the stories that I have heard and the people that I have worked with, it's absolutely have to be a holistic approach.
Yes.
So that you are changing your diet and really figuring out which foods are right for your body and which foods are not right for your body. Some sort of stress management components and stress in the gut do go hand in hand. So, you know, it really does seem to be that you sort of have to take in the whole picture and really focus on self-care, which is wonderful. Again, where are the silver linings? When something goes wrong in our body, it can be, you know, it can either be just this thing that destroys you, or it can become the prompt to say, I need to put my self-care first. And I need to nourish my body with good foods, and I need to live my life in a way that's healthy for my body. And then you can enjoy great health, quiet bellies.
Yeah, I mean, the thing is, I would never trade the way I used to eat, you know, like a really greasy curry on a night, classic food, a classic food to set off an IBS flare, rich, greasy, heavy, you know, red meat. I mean, I just can't put my body through that, and I would rather eat the way I eat because, you know, I'd rather have a quiet belly, like you said, coupled with the regular exercise. I mean, it's just a better way of life for an IBS sufferer.
Or really for anyone, Sabrina. And you and I are both testament to the fact, and hopefully serve as an inspiration, that the way that you eat is probably just, you don't even think about it. It's just what you do, right? It's not hard.
No.
It's not hard to eat foods that are healthy, that are whole food, that are nourishing to the body. Once you, it may be a gradual process to get to that, where a curry does not appeal any longer. But once you get to that place, it's just what you do.
It's just what you do. Yeah, you don't even have a. People often say to me, "Oh, you know, what's wrong with you?" How, you know, but I don't feel the need. I'm happy with the way I'm eating. So yeah, you just get used to a certain way of eating after a while.
And you know that if you ate that thing that everybody else is eating, that you used to think was delicious, you know you're going to feel lousy. So then there's no appeal to eat it if you know that, oh, I'm not going to feel great if I eat that.
Yeah. So, you know, in your experience, what are the top 5 foods to stay away from if you have IBS? Like the top 5 foods that are going to really trigger and flare up people's IBS. I mean, I know there's the low FODMAP diet, and I know there's just general trigger foods, and the general trigger food don't necessarily have to be low FODMAP. But in your experience, because like you said, you've been writing for About.com for a long time, you know, that was way before the low FODMAP diet. Can you give our sort of listeners or viewers a sort of a guide, a general guideline for this?
Sure. I mean, let me see if I can count 5, but stay away from greasy foods, fat, fried foods, anything with high fructose corn syrup in them. What else is just really awful for IBS? So really most packaged and processed foods, you know, all those nutritionally deficient things, cookies, cakes, donuts, right? All that they're doing is raising your risk for heart disease, diabetes, and feeding bad gut bacteria.
Which is the biggest thing. And what about 5 foods now that people should embrace, that, you know, people that are good for gut, you know, so for IBS and gut health and healing?
So number 1 is I do think that most people are very deficient in terms of eating healthy fats. They've really, you know, we were told, you know, be on a low-fat diet, that's what's healthy. But really that turned out to be false science. So healthy fats, so you can get them from salmon, you can get them from things like chia seeds, flax seeds, walnuts, coconut oil, olive oil. Those are all great sources of healthy fats. Greens, people need to be eating more greens. So those green leafy vegetables that most people don't ever go anywhere near. So spinach and kale and chard. And the nice thing is most of those green leafy vegetables are also pretty low in FODMAPs, and so are a great safe place for people to start.
Yes.
What else? I'm a big fan of nuts and nut butters.
Yes.
You know, I think those make very good snacks, and they're convenient, and also, again, help to nurture the gut. And again, I would recommend, you know, whenever possible, to eat organic foods, because you already know you have a sensitive gut. So why eat foods that have been drenched in pesticides and other chemicals? So you want to eat, as you said, eat foods that are as clean as possible, you know, as close to what Mother Nature intended.
And I know certainly this whole idea about organic foods. No, the FODMAP diet does not say you need to eat organic foods. But like you said, when you know your gut is, you know, is sensitive anyway, you want to try to keep it away from things that are going to lead it to more sensitivity and aggravate it more.
Absolutely.
I mean, I don't always buy organic. I mean, sometimes I feel like it's there, but I mean, these are all valid pointers, and they're all sort of very good tips for people.
And this is what I say: if you cannot afford to always buy organic, local, anything grown locally is going to be a much healthier choice than when you're growing a plant that's been grown with acres and acres and acres of that one plant. Because when local farmers grow, they use those old methods. So it's a healthier food. And the other thing is, even a non-organic vegetable is going to be healthier than fast food.
Yeah, no, I'm with you. I'm totally with you on that. So explain a bit about the FODMAPs now. I mean, I know I've had an interview that was dedicated especially to FODMAPs with Marianne, who's a brilliant dietitian from King's College. But explain a bit about the FODMAPs diet in IBS and IBS healing.
Okay, so first of all, let's just define what FODMAPs are.
Yes.
And they are carbohydrates found in ordinary foods that researchers have shown that when people with IBS eat these particular carbohydrates, that they're more likely to get symptoms.
Yes.
So the way that the diet works is you go through an initial period, 4 weeks or so, of really restricting your diet to foods that are low in FODMAPs and avoiding the high FODMAP foods. And then once you're past that initial restriction, a couple things happen. First of all, for most people, they experience symptom relief, which is great because then it keeps you motivated to stay on the diet. I also believe, and so there's research to show, that in that time of restriction, there is some healing to the gut. Yeah. And so at the end of the restriction period, you start to slowly reintroduce the various types of FODMAPs one at a time. And that gives you the ability to kind of figure out, your personal diet, which FODMAPs your body can tolerate and which FODMAPs your body can't tolerate. And so the whole goal of the FODMAP diet is to get to the point where you are eating as wide a variety of food as possible. And again, for me, with my more holistic approach to health, I adore the fact that FODMAP researchers have taken the fear away, that people who are afraid of eating vegetables and fruit because they've gotten sick in the past can start to increase the amount of vegetables and fruits that they eat, which then heals the gut and then opens up a wider variety of foods they can enjoy.
And with the FODMAP diet, I mean, whilst you're on the elimination period, it's not like celiac. If you have a slip up or if you eat like a high FODMAP food by mistake, I mean, it's not going to cause you any really serious illness, is it?
As of right now, there's no evidence to suggest that. And actually, in the clients that I've worked with, I've seen that even those slips can be very educational.
Right.
That, prior to going on the diet, people with IBS are like, I don't know, I can eat this one day and I'm fine, and I eat this the next day and I'm terrible. Like, they get so confused about foods. But with the FODMAP diet, you really get a sense of, you know what, I'm really okay if I eat this food, but that food is going to give me trouble. And so it gives a little bit of sense of control.
Yeah.
Or that, I've again seen some of my clients, they'll be like, well, I'm going to eat this today because I really want to eat this today, and I know I'm going to kind of pay the price over the next day or so. But again, the fact that there's some sense of control, that these symptoms don't appear so much out of the blue, that's a real benefit to the diet.
And is it, we were having this discussion as well, obviously it's where should people start with with a FODMAP diet? I know a lot of it. I know a lot of dietitians, and obviously it has to be done with a professional, a trained professional. It can't be done on your own, because you should not be on a FODMAP diet forever. Even though I probably have been with certain foods that the FODMAP eliminates completely. I'm still eating them. You know, I'll still have onions, and I'll still have garlic, and I'll still but I generally keep away from a lot of the FODMAP foods, and I'm fine. But if someone wanted to start, where would people go?
So really the best place to start is to find a dietitian or health coach to work with.
Yes.
The diet is challenging. You know, the foods that are commonly eaten by people tend to be high in FODMAP. So it's challenging to find foods that you can eat that are appropriate for the elimination phase. So certainly trying to find a trained dietitian or health coach is absolutely the way to go.
Yeah, brilliant. And do you find that it's difficult for people to adhere to the FODMAPs? Because for some people, 4 weeks can be like a long time, you know, staying off a particular food. Do you find it's difficult for people to adhere to that?
You know, that's so individual. I've worked with clients who are just really good at, like, that's it, I'm not eating any more high FODMAP foods, no more wheat for me, no more garlic, no more onions, and they're strict with it and they do fine. Other people, you know, it doesn't go as easily for them. But again, any difficulty with adherence, they then get the feedback from their symptoms, and then they can learn from that, right? And then just adjust. Okay, so I had pizza, and you know, I feel lousy. It's the next day, so maybe going forward for the next 4 weeks, I won't eat pizza. The other thing is that, again, a lot of the clients I work with, and I tend to get people who have more severe cases by the time they sort of wind up with me,
right,
they're already living on a very restricted diet. And so the idea of a restricted diet is not quite as challenging as it would be for a person who has like a milder case of IBS, who sort of eats what they want, but, you know, never really feels right.
No, makes sense. And what other kind of, what's the role? How do insoluble fibers and soluble fibers fit into the FODMAP? Because again, I was taught, Heather Van Boris did a great job of explaining this, and her whole eating for IBS is specifically, you know, how to get the basics right and then introduce FODMAP. So some people might say introduce FODMAPs and then, you know, general basics. So what's your view on insoluble fiber, soluble fiber?
So first off, let me just say I love Heather's work.
Yeah.
I love the books that she's written. They are so helpful to people because they just provide such a supportive framework for people.
Yes.
And Heather kind of, to my knowledge, on her own came up with this whole soluble fiber, insoluble fiber theory, that if you eat more soluble fiber, you're going to feel better, and if you eat more insoluble fiber. And actually, since her books have come out, there has been research to support her views. In fact, the American College of Gastroenterology, in their latest treatment guidelines, recommend a diet higher in soluble fiber for IBS clients, patients, because insoluble fiber can be irritating to the gut.
Yes.
My own difficulty with that is I can never remember what has soluble fiber and what's the source of insoluble fiber. It just, that knowledge does not sit easily with me.
Right.
So what I do like about the FODMAP food is, again, the guesswork's been taken out of it for you. There's that wonderful app from Monash University that I use all the time because I can't even remember what foods are high and low in FODMAPs.
Yes.
But you just look on that app and you get a very quick view of something being a green light food or a red light food. So, you know, in terms of following, you know, to me, the FODMAP diet is a little bit more structured and clear cut.
Yeah, yeah, yeah. I guess, and it's the one that's been scientifically researched at the moment, and that is the diet of recommendation by dietitians and by doctors over in Australia. So tell me, why is it that some foods can sit fine with you one day and then the next day you have them? It sparks a trigger. Is that because FODMAP overload, you know, IBS trigger food overload? Is it because of the state that you're in? You might be overstressed. So what are the reasons, Barbara, why this one food can be fine with you and then the same food is not fine for you the next time you have it? Right.
So it's probably all of the things that you mentioned. So part of it is FODMAP load. that if you eat too many foods containing levels of FODMAP within the same meal or within the same day, you're more likely to be symptomatic. The other thing is absolutely stress. You know, stress affects the makeup of the gut bacteria, and stress affects the workings of the digestive system. And so on a day of lower stress, you might be able to enjoy a food that's higher in FODMAPs without a problem. Whereas on a day of high stress, you're going to have a problem. The other thing for women is menstrual cycle. You know, the hormonal changes and fluctuations, that also can affect, you know, how well you tolerate a food.
Yeah, because I know certainly myself, I seem to get a little bit more sensitive around that time, and I see a lot of people I'm networked with that say the same thing. Does it get worse? So you've just explained it now. And if someone has an attack, how can you control an attack? What's the best ways to get over an attack?
So the first thing I would do would be, whether you're on a low FODMAP diet or not, if you're having an acute flare of your IBS, I would go low FODMAP.
Yeah.
And I would really restrict your diet to only foods that contain lower FODMAP levels. And anything you can do mind-body to calm and relax the mind, because that's going to calm the body and help to calm the digestive system. You know, if you're anxious about the fact that you're having an attack, it's that catch-22 situation where the anxiety then makes the symptoms worse. I'm also a very big fan of heat. So whether it's a heating pad or a hot water bottle, I think that that is very soothing. Heat has been shown to reduce pain. It relaxes muscles, it encourages blood flow, and it calms you. And all of those things are going to help to quiet your system, which is now getting so loud.
And the other thing is, obviously you're a trained psychologist. How can people deal with their anxiety and depression because of IBS? Because it takes over people's life, and yeah, people get anxious with it, and again, it's probably a catch-22 situation. You get anxious, so your IBS flares up, and because your IBS is flaring up, you're getting more anxious. So it's a bit of a cycle. So yeah, how can you break that? How can you reduce your anxiousness?
Well, if you really believe that your anxiety or your depression is at a level that's really unmanageable, then I absolutely recommend that you seek professional help to address the anxiety or address the depression. If it's not quite so severe, then I do think that any of those lifestyle things, practicing yoga, practicing meditation, exercise, Tai Chi, all of those things are going to help to reduce the anxiety. And then one thing that I always work on with my clients, and that is self-esteem. Because when you have a chronic illness like IBS, it really takes a toll on self-esteem, particularly because it's so vague and undefined. You know, I don't think if a doctor says to you, yes, you have Crohn's disease, you're like, okay, I'm a person with a disease. Whereas because IBS doesn't show up on those tests, it feels to many people like a personal failing. Or the fact like, I can't even get this right. I can't even control my digestive system. What's wrong with me? So whether you do that work professionally or you do that work on your own, self-esteem is something that absolutely should be addressed.
I think so. I think you're absolutely right there, because it's not something, it's just IBS. So it's not something that a lot of people are going to take seriously. I know with my own family, they were like, oh, here she goes again. Or, you know, you've sort of messed your stomach up with all this clean eating, and your system just can't tolerate heavy foods. And so yeah, I think you're true. It's right about self-esteem, because your IBS does not define you, does it?
No, you're a person who has a digestive system that needs some nourishing and some help to get it to work the way it should be working. It's interesting what you just said about the just IBS. I recently listened to a webinar with Dr. Pimentel. He's the guy who's very much into small intestine bacterial overgrowth, SIBO theory for IBS. And I don't know if you know, but they just came out with a blood test for IBS.
Yes. Oh, yes.
It really only sort of, it really seems to just diagnose those cases where people are post-infectious. But I loved what you said, which was, and now that we have a test, we can all say, yes, IBS is an illness. And no more of this, you know, it's just something in your head. I loved the way he put that, because too many people are still hearing from their doctors, you know, it's just in your head.
Yeah, makes a lot of sense. Some really good information. So we're going to finish up soon, and if you've got any questions for Barbara, then please go to, if you just go right to the bottom of my page, you can key in the questions there. I mean, as it's Fuel Yourself Fabulous TV, can you give one suggestion, one pointer, one tip so our viewers can fuel themselves fabulous?
Again, I'm gonna make that case for eating healthy fats. Eating healthy fats are just great fuel for the body. They're great fuel for the brain. They're going to make your skin glow. You're going to look amazing if you start to get those healthy fats into your body and really let go of all that nonsense that, you know, a low fat diet is good for people. So I would that would be my. You want to look fabulous, eat more fat. Good fat, healthy fat.
Healthy fat, yeah, that's the key, healthy fat, because when I was training, it wasn't so much the fat, it was the carbs. Yeah, we couldn't go on gorge and lots of unhealthy fats, but we could use fat. It wasn't completely not allowed in our diet, and you need fat because it nourishes your brain cells, your body, your cells are composed of fat, so you actually do need good fats.
Yes, they're anti-inflammatory, they nurture gut bacteria. Again, you take care of your gut bacteria, your skin is going to be, you know, your skin's going to look beautiful, your skin's going to glow. So you want to look fabulous, that would be my biggest recommendation.
Brilliant. I've got a question coming in from Eileen from Manchester, and she's saying, what are the role of probiotics for IBS patients? There's sort of conflicting information out there. Do the FODMAPs first, then go on to probiotics, and some people are of the notion of you should be taking probiotics to get the level of good bacteria into your system. So what's your opinion and thoughts on this, Barbara?
Well, first I want to thank Eileen for the question and say I'm a big fan of probiotics. They are the best thing to have happened to people with IBS. They tend not to have any negative side effects. Sometimes people have a bad reaction, but sometimes it's hard to know, was it the probiotic or something else going on in their life? Right. But they're just those good, friendly bacteria. They're just going to help you in your effort to get your gut to be healthier. Yes. In terms of probiotics and the FODMAP diet, I don't see any reason why they cannot go hand in hand. The only time I've heard that maybe you want to back off on probiotics is if you are being treated for SIBO and you're on antibiotics for the SIBO, because you sort of want the small intestine to have that bacteria for the medication to eradicate, to get rid of. And so you wouldn't start the trial of probiotics until after you had completed antibiotics.
And how long should you be on probiotics for? Again, I read that you should be on them for maybe a month, and then if they're not working, then move on to something else. Is that what you, and is there any good probiotics that you would suggest?
Well, certainly you want a good quality probiotic that definitely, you know, is guaranteed live cultures. You may not be able to find that over the counter. You may need to be going through your doctor for that. Yes. Right, if it's not working for you after a month, you could try a different one. But then I think you could be on probiotics indefinitely. But I'm also a big fan of getting probiotics through foods. Yeah. So fermented foods like good quality sauerkraut, not the sauerkraut that's, you know, in the can with all the salt, but good quality sauerkraut, things like kefir, kombucha, kimchi. I do believe that when you're, first of all, you're eating foods that over the centuries people have eaten for gut health and longevity, and you're getting a wide variety of strains. You know, when you take a probiotic supplement, you're getting a good strain because it's been tested in the laboratory, and so that's great. But when you eat a fermented food, you're getting a wide variety of helpful bacterial strains. And you can be on fermented foods for the rest of your life, and you'll only be doing your body a favor.
Yeah, we had I had Hannah Crum, the kombucha mama, the other day, and she talks really in depth about fermented foods, and I read about it so much. It's something that's been lost. It's Sally Fallon Morell of the Western Aid Foundation. She's brought it back in her book, Nourishing Tradition. So it seems that we're going back to it, but I just wanted to clear that with you because, again, different experts have different opinions on how they should be used, and is there research behind them, or I mean, is there research behind this, Barbara, the sort of use of probiotics for healthy gut bacteria and IBS patients?
So there's absolutely research in terms of the use of probiotics. Fermented foods, maybe not so much, because no one is going to fund a study on whether or not sauerkraut is helping you,
Yeah.
right? But a pharmaceutical company is going to fund a study on whether or not their new probiotic formulation that was developed in a lab is going to be helping you.
Yeah.
But I think we also have just the ancient wisdom, and over the years, so many cultures, healthy cultures,
Yes.
eat a lot of fermented foods. And our current culture is not one of the healthiest cultures, even though we certainly have the most resources.
Yeah.
And I do believe that the lack of fermented foods is part of that problem.
Yeah, I mean, sometimes you just got to apply sort of common sense approach, don't you? I mean, research is fine, but I think, like we were discussing before, everybody is different, so not every food is going to work the same for everybody. I certainly need a lot of protein, because as soon as I stop, I sort of really shrivel up, because of the way I am. So everybody's going to be different, and everybody's requirements are going to be different, whether you have IBS or not.
Mm-hmm. And so I'm going to put in a little plug here for working with a health coach.
Yeah.
Because a health coach is different than a dietitian. A dietitian will sort of give you sort of the recommendations of the American Dietetic Association.
Yes.
But a health coach is going to work with you one-on-one individually to figure out which foods are right for your individual body.
Yeah.
And to figure out how to comfortably include those foods into your diet on a regular basis. That becomes what we were talking about before, Sabrina, where it's just what you do, it's just what you eat, it's what you want to be eating, and what your body thrives when you eat.
Yeah. And you know what, I'm with you on this, because I'm all for kind of health coaching, and I'm all for individualized plans for your body, and obviously that's the way I'm going down. But I'm all for you there, because not everybody is the same, so not everybody's requirements are going to be the same, and not everyone is going to deal with foods the same as everyone else.
Mm-hmm. Right. So what foods are right for me are different than the foods that are right for you.
Yeah.
And again, we can use the research from things like the FODMAP diet as a tool to get started. But then even with that's the whole point of the reintroduction phase of the FODMAP diet, is to figure out which of the foods are absolutely right for your body.
Brilliant. I've got another question coming in. Well, Lisa Ryerson is just saying, is any other useful hints and tips? Anything? I mean, obviously you've shared a lot of useful hints and tips, but any more? Anything more you can add?
Hello, Lisa. The main thing is what, Sabrina, you touched on before, and that is learn to love to cook.
Yeah.
Cooking healthy foods does not have to be hard or time-consuming, but when you cook your own foods, you have control of what ingredients are going into them. And cooking can be such a soothing activity. You really get a sense of all the beautiful colors and textures and variety that Mother Nature has to offer, and you're really getting the maximum amount of nutrients from your foods. I'm also an organic gardener. I'd be surprised at the amount of produce and vegetables and fruits that I grow here. And one of the things about being a gardener is you want to be composting. Now, composting is awesome because all your food scraps you save to put in your garden. And when I see, after I've cooked a meal, the amount of colors that are in my little compost pail, and I know that all those colors, each of which has a host of nutrients, is fueling my body and fueling the body of my family, and that's just beautiful. So not everybody has to garden, but my point is, when you become a person who spends a lot of time cooking at home, you really can get in touch with the beauty and creativity that cooking whole, real foods that came from the ground or were plucked from a tree. I love the way you put that. You really get in touch with that. It's good for the mind, it's good for the body, it's good for the soul.
Yeah, well, they were actually Dr. Robin Chutkan's of God Bliss, her words. So I'm a really big fan of hers, and I'm hoping to get her onto this show very soon as well. So no, that was brilliant. I mean, me personally, our staple for a long time has been curly kale chips, sweet potato, or no sweet potato wedge. I know sweet potato is a high FODMAP food, but for me it's fine, and that's been a staple in our kitchen for forever now.
That's great.
and I feel fine for it, and I look fine for it, and it does not take long.
No, not at all. Not at all.
And Leslie Richards wants to know, is there anything coming out for IBS-D in terms of medication? I mean, I personally keep away from medication. I've never had medication for my IBS for years. I think I was given antacid tablets 20 years ago, which probably affected my stomach lining to some point, because you don't want a stomach that's not acidic anyway. Your stomach should be acidic. But yeah, is there anything medicinal wise for coming out for IBS-D?
Right. So IBS-D, well, the rifaximin, which is the antibiotic, has just finally gotten approval here in the United States for the treatment of IBS-D. There are other medications, there are a bunch of medications that are, under clinical trials, but that's the newest one to just get approval. There are a couple more options for people with IBS-C than IBS-D. I think the manufacturers got a little spooked when they came out with that medication that had such serious side effects. And, so I think that they all feel like maybe it's a little safer to be coming out with products for the IBS-C as opposed to the IBS-D. But listen, it's a huge market. Pharmaceutical companies see that there's money to be made. And so luckily, that is one area where money is going into research. It may not be going into fermented foods or kale chips, but it is going into medication. So hopefully down the road, there will be safe, effective options.
But what's your personal view on this? Like I said, I've never taken any medication for my IBS, and I've controlled it through food very, very well for the last 3 years. I mean, what's your opinion on medication for it? I mean, obviously, if people have more serious issues, and if that's the only way to control it, I'm not gonna say no. But me personally, it's not a route that I would take. So, what's your opinion on it?
My opinion is sort of a balanced opinion, and that is that you should be doing as much as you can on your own in terms of addressing dietary issues, mind, body, keeping your body calm. But again, for people who really have severe issues, sometimes going on the medication and just sort of getting a break from it from a little while,
Yes.
Is a way to just sort of manage. And then as you have that little bit of break from it, you can be incorporating more of the holistic ways of managing symptoms. So, each medication does have the risk of side effects, but on the other hand, if it's going to make a person feel better, I really can't argue with that.
Yeah, exactly. So just on a parting note, if you're seeing this interview on my website, then, do click on the link to get your free report, and that way you'll also be opting in for any future up and coming interviews, because I'm getting a lot of really good guests on, really, and the beauty about these live shows is you can ask the guests questions, and these are all high quality, high profile guests that charge their customers money, so you're just turning up. I'd also advise and urge you to share this information, because there's so many people out there that are suffering on their own. I mean, this is not a plug for my site or a plug for my show. Well, it is, but it isn't, because when I was going through my own heartache, like what is wrong with me, and everyone I was speaking to was, oh, my sister went through this for years, she just did not know what was wrong with her, and she was keeling over, and my hairdresser's telling me about someone who's got really bad IBS and stomach issues, and she's got nowhere to go. My beautician's telling me that she's got a friend who's in agony. I mean, literally, that's why I set up this platform, so people can come along. There's another option for people. They can ask questions. It's informative, and so really, I want everyone to share this, platform and just what we do here. So yeah, that's me. Get your free report. Get on the list for up and coming shows. And is there any sort of anything parting that you would like to say, Barbara?
Well, I would like to invite people to take advantage of some of the resources that I have to offer.
Yeah.
So if you visit IBS.About.com, you'll see I have a ton of information up there on all aspects of IBS.
Yes.
If you visit everythinglowfodmap.com, you will see that I have an online e-course for people who want to learn more about the diet. as well as a training program to get more dietitians and health coaches to know about the diet so that they can support people on the diet. As well as you can find out about my cookbook, The Everything Guide to the Low FODMAP Diet. And then one last place to visit is if you are interested in working with me personally, you could visit drbarbarabolen.com, and you can find out about what services I have to offer. But thank you, Sabrina, because we do need to get the word out. And interestingly, when I published the cookbook, even though I've been writing about IBS for so long, it was when I published the cookbook that people came out of the woodwork and said, you know what, I have IBS.
Yeah.
There was something about the fact that there was a diet for it that made people more comfortable to talk about. So, you know, it's my mission that people should be as comfortable talking about IBS as they are about talking about asthma or eczema. Like diabetes. You should be able to just say, I have IBS, without thinking that you have to be dealing with it all by yourself in silence.
I know, and that's the thing when I say to someone, well, I can't eat that food, I can't go for a curry tonight because I have IBS, and the look I get, but, well, it is what it is. It is what it is. I don't want to be up all night. I don't want spasms in my stomach. I don't want to be off the, you know, and out of it for the day after. You know, it is what it is, isn't it? And I've got to plug Barbara's book here as well, just before we go, the one on the low FODMAP, because it's got my kind of cooking in. It's like healthier foods, working with better sugars than your normal sugar, which is allowed on the low FODMAP diet, and it's just working with better grains. So I'm all for this. So as soon as we finish this, I'm going to jump on and get myself a copy.
Great, thank you.
Brilliant. Okay, so over and out until my next interview. It's Sabrina Khan, fuelyourselffabulous.tv.